I'm Rob Gelb. I'm the CEO of Vālenz Health, and I'm delighted to be here with my friend Ramesh Kumar of zakipoint Health. And today we're going to talk to you a little bit about why we're rewriting the book. And really what we're really doing is trying to transform your expectations of what a health plan should be for you and your employees.
I'm Ramesh Kumar, CEO, co-founder of zakipoint Health. Really super excited about this collaboration with Vālenz Health.
There's a lack of transparency in what's going on, and that then raises expectations of what should happen next. Costs are rising, and there's no explanation because there's an opaqueness to the way that data is shared.
It's also equally important, as Rob, you talked about the data, understanding the population as a whole and understanding where the risks are, where the cost drivers are, what kind of behavior is driving those costs, and predicting that and using that prediction around a cohort, the 8 odd chronic conditions that drive up most of the costs. 5% of the claimants drive up the 50% of the costs.
When you're watching the trajectory of healthcare spend in this country right now, it is unsustainable. And so what we're trying to do here is give you good, solid, simple, simplify the complexity of healthcare, ideas, approaches, tools, resources, and a health plan option that feels a lot better than what you have today. Managing costs, sharing openly data, providing information that you can utilize to make better decisions about your healthcare journey.
Our mission is to bring meaning from healthcare data so that every American can understand the value from their healthcare spend.
Hopefully we've whet the appetite of everybody for what comes next, which is a step-by-step, chapter-by-chapter approach to creating the health plan of the future that addresses and tackles all of these issues on a sustainable basis.
Vālenz Health and zakipoint Health are rewriting the book on the health plan of the future. Why? Healthcare spend is projected to increase more than 10% annually over the next 3 to 5 calendar years. Self-insured employers need to manage the high-cost chronic conditions that drive 5 to 15% of claims, representing nearly 70% of planned spend. And they are looking for partners who can flatten that rising trajectory of costs. The health plan of the future is all about empowering members with the information they need to make the right choices as healthcare consumers. Offering concierge-level navigation for personalized guidance throughout the member health journey. Engaging early and often to offer members valuable cost containment solutions for the right care at the right place and time. Keeping members at the center of your focus, giving them a single point of entry, a digital front door to their healthcare journey. Providing transparency into what healthcare really costs, balancing the equation of cost, quality, and utilization, redesigning the system of contracts and changing the way we talk about networks, and aligning all parties in financing the costs of care as health plans continue to evolve. Put it all together and you can build a true, member-centered health plan that lowers spend, manages care for better health outcomes, and simplifies the complexity of healthcare. Tune in to Chapter 2 to learn more about how Vālenz and zakipoint are creating the health plan of tomorrow, today. Welcome to Chapter 2 of Rewriting the Book on the Health Plan of the Future. Today's chapter is all about consumerism. Consumerism in the self-insured industry has become a big topic, but there's a lot more talk than action. Member choices about their healthcare continue to be centered primarily around the provider or health plan, and members don't have the insights they need to make the right choices in a very complex system. Commercial health plans have notoriously low satisfaction rates. According to the most recent J.D. Power study, satisfaction with customer service fell by 33 points. So how do we prevent that for self-insured plans? Consumerism starts fundamentally with treating members like online shoppers and giving them relevant information about what is available to them, how much it costs, and how to compare with all the other options, so they can make an informed healthcare decision. That's what a reimagined plan by Vālenz Health and zakipoint Health does. We offer everything members need in one place, personalized to their health needs. What we're putting together collectively is this ability over time for members to understand how the system functions and how data translates into cost and quality, and how they can access and use all that information for their greatest benefit. By engaging with members in the medium of their choice and meeting them where they are, we show them, not tell them, that they have the data-driven power to make the right decisions for themselves. That's what's truly unique about what Valenz and zakipoint are building together in driving the health plan of the future. We're helping real healthcare consumerism take hold by putting control in the right place, the hands of the member. Tune in to Chapter 3 to learn more about how Valenz and zakipoint are creating the health plan of tomorrow, today. Healthcare is such a complex system that members need comprehensive guidance and personalized engagement to find their way through. No one should have to navigate it alone. That's why we're rewriting the book on the health plan of the future. Today's Chapter 3 is all about member navigation. Concierge-level care navigation changes the entire experience. By engaging early and often with trusted nurse navigators, members have the best possible start to their health journey. Beginning with high-touch onboarding and then building trust and familiarity along the way, navigators empower members to make better health decisions while controlling costs and improving outcomes. Along that journey, care navigators proactively use data to identify members with complex or chronic health conditions who may benefit from comprehensive case management, providing early intervention with disease management to avoid more serious, high-dollar events. Our care navigators have deep knowledge and understanding of a member's health needs, including their financial health, to connect them to the right providers regardless of network design, including charity care options, high-quality centers of excellence, surgical care, and more. When coordinating properly with the right setting for care and the right opportunity for cost of care, we empower members to improve utilization, enhance satisfaction, and experience better health outcomes. When navigation is supported by advanced digital tools, fully transparent data, and a human touch, we change healthcare for the better, together. Tune in to Chapter 4 to learn more about how Valenz and zakipoint are creating the health plan of tomorrow, today. Welcome to Chapter 4 of Rewriting the Book on the Health Plan of the Future. Today's chapter invites you into the digital front door. Members want us to meet them where they are, which is precisely why future health plans depend on delivering a relevant and personalized point of entry to the healthcare system. A digital front door that encourages early engagement and an opportunity to take responsibility for their health experience. While there are a lot of portals available that simply fulfill the member's administrative needs, the digital front door that members really need includes this and so much more. Our digital front door offers members omni-channel access via phone, online, or the Z Connect app to the Valenz platform of fully integrated solutions. Early engagement, now via Z Connect, allows our navigators to pinpoint member health needs and risks as quickly as possible, aligning costs and quality of care with a provider that's right for them. We offer a data-rich provider search, provider pricing and quality ratings, instant connections to nurses and navigators who facilitate member selection of the right provider and facility based on their health and financial needs, care management and educational support for complex or chronic conditions, and a complete suite of administrative tools for managing their benefits and health costs. Plus, the member benefits from the administrative convenience of having everything at their fingertips: provider directories, ID cards, claim status, care and cost histories, deductible position, and much more. It becomes a very powerful tool in the palm of their hand that allows the member to become a real consumer of their own healthcare spend and health outcomes. By sharing the data members need to facilitate informed choices, we improve cost, utilization, and quality of care for a better member experience. We make that possible through effective education, collaboration, and communication with coverage and benefits experts who have detailed knowledge of the health plan, care plan, and provider network. We know healthcare is a very personal thing, and what has always been missing is an empathetic human touch. That's where the partnership between Valenz and zakipoint becomes especially meaningful. We have turned a purely digital experience into a real omni-channel experience, connecting the member with the right kind of care navigation to specialist services and fully integrated solutions, and providing all that information to the other side for a truly seamless experience. Tune in to Chapter 5 to learn more about how Valenz and zakipoint are creating the health plan of tomorrow today. Welcome to Chapter 5 of Rewriting the Book on the Health Plan of the Future. Today's chapter explores transparency. Transparency may have a lot of visibility due to the No Surprises Act and transparency and coverage regulations, but what we really need is top-to-bottom data transparency, starting with clinical transparency and all across the healthcare ecosystem. We believe transparency has to filter through the entire health journey for the member, and then only when the plan, provider, payer, and member are aligned with visibility and transparency into the data can we drive smarter decisions about the member's healthcare. The member understands their treatment and care plan and is more empowered to participate in their care. The provider understands what and how they're going to be paid. The employer understands utilization is being managed and the right services are being provided, along with exactly what's covered and where the best health plan cost savings are derived. And the payer reaches shared agreement on claim costs. Successful self-funded plans make this happen on the Valenz platform by aggregating years of robust claims data from thousands of provider network cases with industry-leading sources of payment, cost, and charge-based data sets, together with clinical data. Fortunately, regulatory and technological advancements are improving employer visibility to actual costs of care, with supporting data analytics to forecast future expenses. Our mission is to bring meaning from healthcare data so that every American has access to better transparency regarding costs, gets the right direction, and is able to understand the value from their healthcare spend so they can make the best decisions as true consumers. When members have a deeper understanding of their healthcare choices, they'll have less anxiety about whether they're doing the right thing. That's how we achieve smarter, better, faster healthcare and drive healthier outcomes for everyone. Tune in to Chapter 6 to learn more about how Valenz and zakipoint are creating the health plan of tomorrow today. Welcome to Chapter 6 of Rewriting the Book on the Health Plan of the Future. Today's chapter is all about achieving balance and optimizing healthcare for the member, employer, payer, and provider. It begins with providing solutions that balance an equation of quality, the utilization of proper medical services, and the cost of paying for those services. Let's start with the cost and define it in a consistent manner. Balancing cost requires a transparent and visible expectation of the full costs of care, the member's out-of-pocket expenses for each episode of care, the employer's costs, including total spend and the per-unit cost of service. Just think about the potential of having this cost data set. It allows the member to walk into a healthcare facility and open up their digital front door app, understand what the provider gets paid and what the various means for payment are, as well as what the provider accepts for payment. The member walks out knowing exactly what they're paying for and what services they are receiving. Now let's discuss quality. Quality starts with proper credentialing and licensing of providers, a baseline for members so they know their provider has up-to-date credentials. Members also need insight into providers' quality metrics and reviews and their experience in treating specific conditions. The greater the provider's experience and frequency of performing certain procedures, the higher the likelihood of a consistent high-quality outcome. Quality measurement is an opportunity for our industry. While the app and navigators have insight into general quality results and member ratings of the patient experience, it is difficult to predict clinical outcomes based on a specific procedure or condition. And value-based performance is even trickier, requiring reimbursement changes based on hospital-acquired infections, complications of care, and readmission data. The third part of the equation is ensuring appropriate utilization of care and ensuring members are navigated to the right provider and place at the right time, and leveraging data to predict care needs and drive the best possible outcome. Bottom line, bringing visibility into quality metrics, utilization, and cost through transparency tools is essential to protecting the overall financial viability of the health plan. Tune in to Chapter 7 to learn more about how Valenz and zakipoint are creating the health plan of tomorrow today. Chapter 7 of Rewriting the Book on the Health Plan of the Future explores contracts and networks. Let's think differently. When we talk about healthcare networks, there's a perception that you need a contracted network in order to receive a guaranteed reimbursement and avoid balanced billing for the member. This is not 100% accurate. In fact, we are seeing a redesign of the traditional system. Before discussing networks of the future, let's quickly refresh on available options today. A contracted network is a custom-designed network of rigorously vetted physicians, hospitals, and ancillary providers for high-quality, cost-effective care. What's known as an open network is a non-contracted reimbursement approach with navigation and care coordination to reduce costs, enhance transparency, and improve the member experience based on the financial and health needs of the member. Providing additional risk support with non-contracted reimbursement models, the assured payment model ensures secured plan savings by auto-adjudicating claims less than $2,000 and initiating full claim review to maximize savings on the remaining claims. Finally, minimum essential coverage is supported with open access non-contracted networks with assured payment options, improving access to quality care and realizing 50 to 75% cost improvement and improved member experience. Networks of the future are available today. It's the data that drives everything, allowing us to provide a fair and reasonable market-sensitive price for care. Our approach integrates numerous data sets to yield a defensible local market rate in collaboration with the provider. Regardless of which contract or network, members need full transparency and personalized navigation to the most cost-effective, high-quality care options based on their financial status and health needs. Our next-generation network design means members are supported for each care need regardless of contracted network. We can leverage centers of excellence or pre-negotiated care imaging and surgical bundles, or direct the member to 501(r) charity care facilities for those who qualify. When you start with these more modern and innovative programs that are designed to offer quality access to care, you get the member comfortable with benefits that economically meet their needs and how they can make smarter, better, faster decisions. Tune in to Chapter 8 to learn more about how Valenz and zakipoint are creating the health plan of tomorrow today. Throughout our series, Rewriting the Book on the Health Plan of the Future, we've explored why it's important to engage early and often, balance quality, cost, and utilization, and align all the parties to achieve smarter, better, faster healthcare. Today's final Chapter 8 focuses on ensuring strong, vigorous, and healthy lives for everyone in the ecosystem with smart financing. It's important to start working on financing early in the process of creating a plan. When it comes to financing a self-funded plan with the appropriate payer, the answer is not the race to the lowest quote. As employers review plan options that are more member-driven, they need to ask themselves, do cost containment solutions align with the summary plan description? How can we engage with providers to make them part of the plan that meets the personalized needs of its members? Are navigators prepared to direct care based on both the financial and health needs of the members? How can we create incentives to make sure the member is taking charge of their health care? And is the plan structured for the right financing option? From a financing perspective, health plans should use enhanced analytics to assess financial risk and engage proactively with stop-loss underwriting. They can further mitigate fiduciary risk by aligning stop-loss underwriting with cost containment solutions outlined in the summary plan description. Engaging early is key. This assures plan sponsors that their premiums are fully representative of the value of cost containment, while also realizing meaningful savings and more easily predicting costs year after year. Structuring the finances as a captive leverages a larger, more diverse population to reduce plan level and catastrophic risk, while delivering exceptional cost reduction strategies, increased underwriting credibility, and long-term stability for employees. Regardless of how health plans get funded in the future and how many will continue to be employer-sponsored, keeping the member at the center of financial planning will align everyone in making smarter, better, faster decisions about healthcare.
Well, my friend Ramesh, we've come to the end of a very, very informative book. We thought it might be nice with the audience to maybe recap. We wanted to share what we see as the vision for the health plan of the future, really thinking about that front to back member journey. And so what we've tried to do is think of the member as a consumer and give them the opportunities to do more with the data from a transparent world that's available to them.
It's been a great experience sharing this book together, and super excited for our listeners to take something of value from this and incorporate that into their business, whether they are a employer or a broker or a TPA or a health plan.
We built this with the idea that we would help inform all the value chain participants with information to allow for better decisions.
And to kind of have that integrated experience, the digital app experience for the member, and leveraging things like the AI capabilities, one-to-one live communication, and have the tools in their palm to be able to support the member.
Wrapping it together, it starts with a vision of integration being both services and data sets that kind of marry up and work together to inform all the participants to the value chain, bringing Zaki and Valenz together, create that digital front door experience that support everyone making smarter, better, faster decisions on their healthcare.
We've seen this with the digital front door and having the nurse navigator behind the scenes to steer that member to high quality, low cost places. We are seeing somewhere around 25% of the members being engaged. And this number is actually even higher when you look at the high risk population, which is where much of the risks and costs are.
Absolutely. And everything we set out to do with both building the model and then exploring and sharing over the course of a book and chapter, it's working. And we would love for people to kind of think about an integrated solution that dovetails what we've described to them. In my mind, this is the way healthcare needs to go. And this is what plans and employers should be thinking about as they set out to try and improve the overall experience for their members. And if they're interested in how they can deliver smarter, better, faster healthcare, take a look and contact us.